How do you think you're going to do today?
I can run this play. No problem.
Well, Phil, he sounds pretty sure of himself.
Yeah, he's got all the confidence, but with none of the experience, Bob, this could get ugly.
Oh my, oh my, oh my. It's about to get real on today's Call, Don't Fall Challenge. Phil, let's break down what our patient is up against in the Call, Don't Fall Challenge.
Well, Bob, there's a higher risk of falls while you're in the hospital, and here's why. You got medications, you got the unfamiliar environment, your interruptions in your sleep patterns, which cause fatigue, and then there's equipment in the room which you're not familiar with, and last but not least, you've got surgical or procedural sedation going on, and that's a big one right there.
Oh, how about them apples?
Sounds serious.
Oh, it is, and that's why we're here.
Oh, great.
Well, since you're not going anywhere, have we got a plan for you on today's Call, Don't Fall Challenge. Now, I'm sure our patient is wondering what in the wide, wide world of sports we're doing here and why.
Well, Bob, I talked with the nursing staff before the challenge, and they shared some interesting stats about falls occurring in the hospital. It's a known fact that falls occur most with patients that are between the ages of 40 and 65. The other interesting fact is, and Bob, I think you know this already, most falls occur in the loo, the bathroom, the outhouse, sitting on the throne.
So, break it down for us, Phil.
Well, Bob, here's where it gets real when it comes to the bathroom zone. As you can see, we have a patient bed here, and the toilet is here. But look, obstacles everywhere. The chair, the IV pole. The patient has to get from here to here, and the risks are obvious.
Let's go live now to the cam.
What we have here, Bob, is the classic solo start. Very typical, but with any fall risk, never a good idea. See, there's the obstacles I mentioned. It's a labyrinth of tricky maneuvers to reach the goal. There's the standard IV pole handoff. Very dangerous because you have zero stability. He really needs to trust his support team.
Sounds like he could go all the way if he only had a plan.
Bob, the team here at St. Luke's does have a plan. The key, he just has to use it. All patients have their own safety plan.
Well, for more on what your plan is going to look like, let's now go to sideline nurse, Nurse Abby.
Thanks, Bob and Phil. I'm here with my patient, making sure he knows I have his back, going over the safety plan. Now, a typical safety plan includes education about the plan throughout your stay and a fall risk assessment at the beginning of each nurse's shift. Now remember, let's follow our game plan. Okay, I'm here to keep you safe with protective equipment on the sidelines for when you're ready to go, such as a gait belt, a walker, or a lift. Now, we also like to include the family members or caregivers in the education and safety plan whenever possible. Okay, guys, that's the update from here. Now back to you.
Thanks, Abby. It's time now to go to the whiteboard. Phil, tell us what's going on at the whiteboard.
Well, Bob, I'm here at the whiteboard, and this is where the patient fall risk is noted so that anyone coming into the room can see it.
What does a high fall risk look like?
Well, I'm glad you asked that, Bob. The patient will have a yellow wristband in the case of a high fall risk, and depending on their condition, the staff may assist them using a bedside commode. Again, the whiteboard will note the high fall risk, and the reason will be put in the care plan. But remember, the risk of falling is real for all patients, not just the high fall risk patients.
Phil, this just in from our sideline nurse, Abby. She is indicating that the patient has a few responsibilities. Can we go to her now? Is she ready?
Bob, Phil, I am right here beside my patient with some important tips. Now, we know a patient may be uncomfortable with us helping them out, especially in the bathroom. But we need patients like you to trust us. My priority is your safety.
Care about your safety, really. Don't want you to fall. Rely on us to do what's best. You know who we are. Help us out and do your part. You know where we're coming from. Call me. Here's the line. Call me anytime. Call me. No trouble. You can call me might need assistance maybe whenever you get up. Putting slippers on your feet just might not be enough. Slips and falls, we don't know why. Let us be your alibi. Call me, here's the light. Call me, anytime. Call me, no trouble. When you're ready, we will have the time. Call me. It's right, call me, anytime. Call me, for a ride, call me, even if it's overtime. Call me, not luck, call me, even 100 times. Call me, don't you dare get up, don't even try. Call me.
Well, that's a wrap.
And another game win for the patient.
As long as the patients rise to the call, don't fall challenge, they'll remain undefeated for sure.